Here we go. It's part 1 of the muscle system here in chapter 10, and I'm starting a new video playlist. We just did videos of the head and neck, and now we're moving on to the torso. And in this particular video playlist, we're going to consider the muscles that are intrinsic to all parts of the torso, as well as some of the more superficial muscles that are actually attached to the shoulder and move the upper extremity. And then I'll move on after the torso to the actual upper extremity, in which there are muscles innervated by the brachial plexus and the lumbosacral plexus. Right, so brachial plexus of the upper and the lumbosacral plexus of the lower extremity. Meanwhile, this is the torso. Okay, and I'm going to present you now with this picture, and it's going to also be, I'm going to factor a few more things in here. Let's take a look at this little bracket right here. This is called Erector Spinae, and there are 3 sets of muscles here. So this is actually a group of muscles, Erector Spinae, and the group has 1, 2, 3 parts to it. And you'll notice that the most medial part here is referred to as spinalis. Okay, spinalis actually has several different regions, spinalis thoracis and other parts, but we're just going to say spinalis, okay, for this. And then this region through here, this continuous area of muscle, is referred to then as longissimus. Okay, longissimus. And then we're going to have an outer region out here, okay, that has sort of longish little tendons to it. And the orange area here represents muscle belly. And that's going to be called iliocostalis. Okay, so from medial to lateral, it's spinalis, longissimus, and iliocostalis. Okay, and these are postural muscles. That's their main work, and we're listed over here on page 338, Erector Spinae, and they have some discussion of it here in terms of origin, insertion, and so on. What you're mainly seeing here with these muscles is we're going from mostly, in this case, transverse processes to ribs, or from ribs to transverse processes. Here we're going from rib to rib, and the same thing out here. Okay, so they make further distinctions here along the way that you can check out. They have iliocostalis, longissimus, spinalis. If we look here at the spinalis, the most medial aspect, we're going from spinous processes, in fact, as well as lumbar and lower thoracic vertebra, and then we're moving on. The insertion is spinous processes of upper thoracic. Okay, so they're kind of like swinging along here through, how shall I say, this is actually sort of like, we call it the gutter region, or there's a depression here where the ribs sort of like move inward a little bit and deeper. So there's this deep area. We're going to also be noticing another group when we get down to it. But first I want to continue the discussion here of the Erector Spinae. If we were looking at a beef cow or a steer, that sort of thing, a calf, we would actually be looking at tenderloin. That's what this actually is here, is tenderloin. And if we take a look here at the actions, we're going to extend the back is basically what's going on, and for sure these are going to be pretty much involved in posture. So the main thing is the maintaining of an erect position, standing or sitting for that matter, and maintenance of posture. Also, we can use these unilaterally to move from side to side. There's a certain amount of bending possibilities, and so on. Okay, but another thing that I want to bring to your attention here, and I'm taking a little extra time to do that, is that I want to present to you this little view right here. Here are some more superficial muscles. We have this big one here that's called Trapezius, and then we have this one right here, which is called Latissimus Dorsi. And you'll notice Latissimus Dorsi is arising from a flat tendon right here, and I'm naming that for you, thoracodorsal aponeurosis. So thoraco, T-H-O-R-A-C-O, dorsal, thoracodorsal aponeurosis. So it's the back of the thorax, and it's a flat tendon, aponeurosis. What I'm not able to show you is that this is two-layered. So we'll talk more about the latissimus dorsi as time goes along. It's a muscle that goes on the inside of the humerus here and then actually attaches to the humerus in the front. So it wraps around that way and it pulls down on the humerus when it contracts. At any rate, I'm more concerned right now that you pay close attention to this aponeurosis. There's two layers here. The first layer you come to from this posterior view is called the posterior lamina. Okay, it's the posterior layer. You cut that open, and what do you find inside is the erector spinae. Okay, isn't that interesting? And you can actually reach all the way around the erector spinae if you're looking at a cadaver. Here's a cadaver now, and you could actually cut straight through here, or on this cadaver you could cut through here. In either case, it's a little bit easier to visualize, though, when you're looking at the artistic drawing. You can cut through here, put your fingers around the erector spinae, and then the front of your fingers will be resting against the next layer of the thoracodorsal aponeurosis, which is the anterior lamina. Okay, so there are two layers of this flat tendon, and the erector spinae is sandwiched in between the two layers. Okay, I needed to make that clear to you, so that at some point we are going to be visiting in person Merritt College again, and we're going to be in the cadaver room at some point. Friday nights are always cadaver dissection nights, and you're welcome to come to that event where I teach a class in cadaver dissection. And you can come as an observer for no money at all, or you can come as a participant for a little bit of money. Okay, it's a fee-based class. So at any rate, you can see cadavers, and that's part of the program, is that we've developed a program where we keep 4 cadavers. Alrighty then. So we found the erector spinae. Also associated here, right here, is the posterior wall of the abdominal cavity. So if you're inside the abdominal cavity, looking around, maybe from the front view or from the back, at any rate, this is the back wall, and it's referred to as the Quadratus Lumborum. Okay? Some of you might actually be able to place your fingers here on the side. If you are lying on this side of your body and sort of curled, you can sort of bring your fingers down on the side and pinch your waist and actually feel this muscle coming up from the iliac crest right here. And it's going to the transverse processes, as you can see, as well as the 12th floating rib right there. Okay, so that's part of the program. I'm not asking you for innervation of any of these things. These are mostly used for postural purposes and to assist with mild bending, either posterior bending, extension, or side-to-side bending, flexing side to side. Here we have another group of muscles. This is called Transverso Spinalis, and it's made up of rotators and multifidus for the most part, and those are the ones I want you to learn. The multifidus are a little bit more, how shall I say, horizontal, whereas the rotators are, or they're longer actually. The multifidus are longer and the rotators are a little shorter, and they fill, again, that sort of region that I was calling the gutter region right through there. And what are their purpose? Their purpose is for rotation left and right. And how are they grouped? They're grouped in what's called the Transverso Spinalis group. Okay, so I need you to associate that name with these two muscles because I have a question on the quiz for you that has to do with that. Okay, so that pretty much covers that piece of information there.